Hello, everyone. My name is Amanda Talavera, and I will be the third speaker on the opposing team for not prosecuting nurses for unintentional medical errors. Overall, nurses are trained to be honest and acknowledge errors, which enables hospitals to improve and make sure these mistakes don't occur again. It's crucial for hospitals to create an environment where nurses and other healthcare professionals feel safe reporting miscare without the fear of punishment. Legal actions against nurses for unintentional mistakes can create fear, discouraging nurses from reporting errors or near misses due to potential legal repercussions, which can also result in missed opportunities to enhance protocols and improve patient safety. That said, patient safety should never be taken lightly. It must always remain the top priority in healthcare, and any incidents of harm should be viewed as a whole picture and not just the individual. To continue to promote safety of the public, nurses should have their license revoked instead of being prosecuted for unintentional medical errors. As nurses, we are committed to do no harm, no maleficence, act for the benefit of the patient, benefits, take accountability for actions, and promote justice. These are core competencies listed in the American Nurse Association Code of Ethics. By revoking nurses' license, this will ensure incompetent nurses are no longer in practice to cause further harm to patients. However, prosecuting nurses goes to the extreme. Errors are inevitable and can happen in any profession. Hospitals today are experiencing severe shortages of nurses, along high levels of nurse burnout. These factors and a combination of heavy workloads and lack of communication between healthcare professionals can cause medication errors. Taking legal action against a single nurse will overlook the larger systemic issues, preventing any real changes from happening. If anything, this will also further increase the nursing shortage and fear of legal consequences. An exceedingly rare case occurred in 2022 when Ron DeVault, a nurse from Vanderbilt, was prosecuted for injecting zirconium instead of Versed. This powerful paralyzing medication caused the patient to stop breathing and eventually died. Rhonda was sentenced to 3 to 6 years for negligence. This mistake never should have occurred, and many mistakes were made in the process. Rhonda reported her actions immediately after administering the medication. In Rhonda's case, the American Nurse Association made a statement expressing concerns about Rhonda's conviction, saying it sets a dangerous precedent of criminalizing the honest reporting of mistakes. Some medications are inevitable. That statement said there are more effective and just mechanisms to address them than criminal prosecution. The ANA were not the only ones to speak for this case, but as well as Robin Begley, nursing officer for the American Hospital Association, predicted this case will have a change on the culture of safety in healthcare because it would discourage medical staff from coming forward with their mistakes. This is not to say Rhonda should not be held accountable for her mistakes, because at the end, she should have been informed of the medication she administered, as well as performed her 5 steps before administration. In conclusion, while patient safety is always a top priority, and nurses should be held accountable for their mistakes, prosecuting them may not be the most effective solution. Though the argument for prosecution suggests it serves to prevent future errors from occurring, it can actually have the opposite effect in healthcare today. If legal action becomes the norm, nurses might be reluctant to report mistakes due to fear of punishment, hindering efforts to learn from errors and improve practices. This approach could also discourage individuals from entering the nursing profession, worsening the existing shortage, which in itself contributes to medication errors. By prioritizing system improvements over individual punishment, healthcare providers can enhance patient safety while safeguarding the nursing workforce. Thank you.